Long considered the silent killer because it typically lacks symptoms, hypertension, if gone undetected and untreated, can lead to serious illness and even death. We talk with Dr. Lee Carter of Hoag Memorial Hospital Presbyterian in Newport Beach about the diagnosis and treatment.
Hypertension is an elevated pressure inside the vessels, specifically within the arteries. So when someone says high blood pressure, it is a simplified way of saying somebody has hypertension. The common term hypertension would be used by the physicians and high blood pressure would be used by the patients. Some people are convinced they get symptoms with high blood pressure. The vast majority of people don't get symptoms with high blood pressure unless it gets to a severe state where it's caused significant damage to the kidneys or the brain or the eyes. Most people that have blood pressure that needs treatment won't feel any symptoms whatsoever. Ideal blood pressure is, in general, the lower the better. Specifically, the cutoff seems to be about 115/75 for having freedom from an increased risk of stroke or an increased risk of a heart attack. As you go above those numbers, for any 10-point increase in the diastolic or any 20-point increase in the systolic, you double your risk of stroke and heart attack. And the higher the blood pressure, the more likely it is that your physician would want to start you on a medication. Untreated hypertension is a major problem because once the blood pressure starts to rise, usually there's some damage to the vessels, some damage to the kidneys that tends to perpetuate the problem. So once the blood pressure has been elevated for a while, the body's gotten used to that higher blood pressure and will defend any attempts to try to lower the blood pressure below that. Therefore, you get very difficult to control high blood pressure. And if someone has had high blood pressure for a long time, it's put a lot of strain on the vessels. Specifically, the problems we see are the heart attacks and strokes, which tend to go up. The major lifestyle changes that I like to push upon my patients, first of all, is the need for weight loss. That's first and foremost going to take care of a lot of their problems. The way they go about weight loss would be diet. Is very useful. If they cut out the saturated fat, if they increase their intake of fruit and vegetables, that tends to be beneficial. Daily exercise is important. I only want my patients to do this once their blood pressure is controlled. If they come in with a sky-high blood pressure, I don't want them to go out and jog, but usually we can get the blood pressure down relatively quick. Third is sodium. High intake of sodium is a problem, and so I try to educate my patients on where that comes into their diet and how to avoid it. And last but not least, I like my patients to keep the alcohol intake controlled. Usually about 2 drinks a day tends to be the maximum that is well tolerated. Anything higher than that, the blood pressure tends to rise. Alcohol is beneficial for the heart in general, but after 2 drinks, we tend to lose that benefit. Hoag has a big advantage for, I think, our patients, not because the blood pressure is treated per se at Hoag. Hypertension is in a large degree an outpatient disease. It's seen in the offices of the internal medicine doctors, the family practitioners. It's diagnosed there, it's treated there. But I think the advantage that we have is that we've had a very good medical community here over the years, and I've been very impressed over the years with the quality of the doctors that practice at this hospital. And specifically the advantage for our patients at Hoag is that if they hit troubles later on, we've got an excellent heart and vascular institute which can help get people out of the further difficulties they can get if the hypertension has led to problems.